Okay, why don't we kick things off? So, thank you everyone for joining. I'm Laura Collins. I work with Go Parks London and London Friends of Green Spaces Network. Thank you so much for joining us. Sorry, I'm going to be doing the admin behind the scenes as well. So from time to time, I might get distracted by someone joining the lobby or anything. But yeah, just to say, so this webinar is about how friends groups can get involved in green social prescribing. It's a really terrific area for us all to get involved in. Um, it's a wonderful opportunity to diversify and improve inclusion and help more people gain access to the benefits that green and blue spaces in London can provide. So I'm really looking forward to hearing from Laura Brown from Natural England, who's going to talk to us about green social prescribing and also give some tips around how to access this. And so she's going to give a presentation, and then there's some time for a Q&A afterwards, and then we will wrap up by noon. And also just to say, we are recording the webinar so that we can put it up on the website for anyone who wasn't able to join us today. And also just a bit of housekeeping. I think probably be good to turn microphones off so that we can hear Laura loud and clear. So with that, I will hand over to Laura. Thank you, Laura.
Hi, everyone. So I can see a few familiar names and faces in the meeting. Certainly the names of lots of familiar green spaces, so that's great. So I am just going to share my presentation. Hopefully that will all work smoothly. So if you just give me a thumbs up if you can see the picture on the screen. Awesome. Okay. So yes. You'll see there the logo of Happier Outdoors. I'll be talking about that a bit more. But just to give you a quick introduction to me. So I'm Laura. My pronouns are she, her. And I am the Higher Officer for Health and Environment for Greater London at Natural England. And I cover all of Greater London, but nothing beyond it. And my role is to support organizations delivering green and blue social prescribing activities in the capital. And we'll talk a bit more about what that means. So I'll just start for those of you not familiar with Natural England. We are an arm's length body of the government or non-departmental public body, if you want to be fancy. And our sponsoring department is DEFRA, so we come under their sort of umbrella, but we do have a certain degree of independence as well. So Natural England does quite a lot, actually. We are the government's advisory body on England's natural environment. So you may have heard about us granting, for example, protected species licenses, designating sites of special scientific interest, that sort of thing. I can't tell you a great deal about those activities because that's not the side I work on. But I work on perhaps a slightly less publicized aspect of our work, which is connecting people with nature, and particularly connecting people with nature to improve the health and well-being of both individuals and communities. So I work on the strategic side, so I don't deliver activities myself. You can't go to a green social prescribing session set up by Natural England, but I do support the organizations that deliver those activities. And that can include just finding out what's out there, signposting people to sources of help, giving advice, and I do have a network set up, which I'll talk about in a moment, to help organizations involved in this work. So green and blue social prescribing. I assume you all know what green social prescribing is, or you probably wouldn't be here. Blue social prescribing is along the same principles, but it involves water rather than land. And green and blue social prescribing is basically a very fancy way of saying encouraging people to spend time in and connect with nature to improve their health and well-being. Now, there is loads of evidence regarding the beneficial effect of nature on health and well-being. I could give a whole presentation on that, and in fact, I have a whole presentation on that I do sometimes give. But this is just an example of the research that's been done. So for those who like targets, it's been found that spending at least 120 minutes a week in nature is associated with better health and well-being. That's self-reported. It can happen in any natural setting, so it doesn't have to be a big nature reserve. It can be a small park. Doesn't have to be done in all in one go. And the study has been controlled so that we know that's not solely about just getting more exercise or anything like that. And apparently the benefits keep increasing up to 5 hours a week. After that point, apparently you don't get any further benefit from spending more time in nature, although it's certainly something I would recommend if you can do it. So I know a big question is how to get people referred to your park group's activities through social prescribing. So there was a vision that was initially behind the NHS adopting social prescribing. Now, you could argue that social prescribing really has been around forever, just saying, go and do this, it may help you feel better as a form of social prescribing. But the formal pathway that was envisioned for the NHS is that there are professionals called social prescribing link workers. And there is one usually attached to each GP surgery, although that doesn't mean that each GP surgery has one to themselves. Often it's one link worker covering several surgeries within a primary care network. And the way it was supposed to work is that someone would go to their GP, and like, about 20% of GP patients, they would be coming in with some problem that either wasn't really medical or wasn't entirely medical. So something like loneliness, mild to moderate mental health conditions, something where, simply prescribing medication is not necessarily going to be the best approach. And the idea was then that the GP would refer that person on to the link worker. That person would have an in-depth conversation with the link worker, just about what matters to them, what they'd like to do. And the link worker then has extensive knowledge of local activities, and can refer the patient on to something that would be suitable. So that was the vision. That's not how it's happened in reality. Um, and sorry, I'm just going to mute everyone because I think there we go. Mute all attendees. Okay. Yes. So it's not quite how it's worked out in reality. The reality is that link workers have found themselves very overworked. They tend to be expected to make up for gaps in social care. So they're referred people who are having very serious issues with housing, maybe with immigration status, that sort of issue. They get referred people often who have quite severe mental health conditions, for example, who are suicidal, which is not really what the role was supposed to deal with. The reality is then that link workers tend to get very overstretched. They're not really able to perform the role in the way that was initially envisaged. And so I find that small grassroots organizations doing nature activities, the rate of success when trying to get formal referrals through that pathway has been relatively low. There have been areas of London where it's been quite successful, usually because there was a particular link worker or a particular GP that really wanted to stress this, but often with the other pressures on the NHS, it's not really worked out very well. Now, that's not to say you shouldn't let link workers in your area know about your activities, just that you shouldn't necessarily expect that you then get a big flow of referrals from that. So if you do want to let your local link workers know, and certainly I would encourage you to do that. Transformation Partners in Health and Care have a London social prescribing map, which you can find online. You can just search London social prescribing map. Social prescribing in London is organized by boroughs. So each borough has organizations that have been contracted to provide that service and to host the link workers. So what you can do is go onto that map, find your borough, and you will find all the details of the organizations that handle social prescribing in your borough. And there will usually be an email address. And what I suggest is have information that's as complete as possible that you can send to the link workers. I really recommend having a leaflet, or a poster that they can just print out and just hand to their patients. Just explaining, what you can offer, who the activities are suitable for, um, what kind of support people can expect, if they, get to sit down and have a cup of tea afterward, if they'll be welcome to the site. Just really everything, and I'll get to, in a moment, I'll get into kind of what makes an activity especially welcoming, but you just kind of want to lay it all out for people what they can expect when they come to your session. And, I would certainly recommend sharing that with the local link workers if you would like to get referrals. Just be aware that because of some of the other pressures that they're under, that may not be as successful as you hope. Um, so, despite the fact that the formal pathways haven't worked particularly well, I do think that green and blue social prescribing is thriving in London. And the reason for that is that referrals tend to happen informally. And this is something that is not unique to green and blue social prescribing. I think it's happened with other forms of social prescribing as well, to the point where the National Academy of Social Prescribing has actually moved away a bit from focusing on the more formal pathway and are looking at things like community champions, just people who are within a community and just sort of spread these ideas through word of mouth and through their connections, um, with their neighbors and friends. Um, so places that social prescribing referrals often come from include community organizations. As I said, there are local champions, local health champions in some areas. Quite often it's just word of mouth, friends referring friends. And then very common is self-referral. So, someone just isn't feeling great with their life, is looking for something they can do. Maybe they spot a poster somewhere, maybe they spot something online. Um, One thing I would say is to attract self referrals, don't rely too much on online information, because there is still a big part of the population that's digitally excluded, who will never see that. But also, it's a lot harder to stumble across things online. Generally, people go online, they're looking for a specific thing. They may find what they're looking for, but they don't find the things that they didn't even know they needed. Um, so I would certainly recommend offline methods such as posters, maybe having leaflets, possibly getting an article in your local paper, that sort of thing. Right. So um, the main thing that will determine whether you are successful in providing green and blue social prescribing or not is how welcoming your activity actually is to people with health needs. So the list that I've developed here, it's based on conversations with link workers about kind of what their clients are telling them, and specifically kind of barriers that may cause a client to conclude that they don't want to take part in an activity. It's also based on referring successful activities, successful projects that I've visited, and just seeing what they provide that seems to make them so appealing and successful, and having that healing effect for people. So one really important thing is reliability. So if you are advertising your activity as taking place every Tuesday, you do need to be there every Tuesday, or there needs to be a very clear way of communicating to members of the public who haven't been there before that you will not be meeting on a particular Tuesday. Sometimes I'll see that organizations will have on their website, oh, we do community gardening every Tuesday, but then they've got some other way to communicate with regular participants, like a WhatsApp group or whatever. So they send a message out to the WhatsApp group saying, by the way, we're not meeting this Tuesday, but they don't then amend their website to say that. Someone who's turned up for the first time just finds that no one's there and doesn't know what has happened. And for people who are coming through social prescribing, who often, are struggling with a bit of mental health difficulty or a bit of lack of confidence, maybe, quite often they have been let down by other people, by other institutions. So to turn up to something and find that it's not happening it can mean that they never attempt to do that thing again. So that's the first point that I would stress. Another thing is give information about how accessible your site and your activity are. Information about accessibility is really important for anybody really suffering any type of disability, whether they're a wheelchair user, visually impaired. You may not know exactly how accessible your site and activity are for some of those conditions, but there is a lot of support available online, like for people with visual impairment, the RNIB has developed lots of resources. And for similar disabilities as well, if you just do a search, you'll find toolkits kind of explaining how to determine how accessible your activity may be. Um, but accessibility can also be about perhaps a bit more mundane things like whether toilets are available. Um, I always say when I got a nature-based role, I didn't realize I'd be spending so much time talking about toilets, but actually they very often will make the difference as to whether someone feels comfortable visiting a site or not. Um, especially people with, various health conditions or anxiety, they will kind of need to know whether there's a toilet on site for their use. I'd say also, if you have a gender neutral toilet, anything like that, that would help people, with diverse gender identities feel more welcome, do include that information as well. You should give very clear instructions about how to join an activity. Because it's happened more than once when I've been visiting kind of a friends group activity in my role that I'll kind of arrive and I won't know where to go. And there'll be a little group of people milling around who kind of all look like they know each other. And I'm not sure if that's where I'm meant to be or not. So that can be a bit intimidating for newcomers, especially if they do have any kind of social anxiety. So I would just say, in the information that you provide, whether on your website, in a post or whatever, just say we meet at this point in the park, maybe look out for a person in this type of jacket or, any kind of signposts that people can use. And I would also just give a little rundown somewhere about what to expect during the activity, like maybe everyone starts by kind of greeting each other, chatting about their day, or maybe you get stuck right into the work. Um, just anything that can make the experience feel a bit less unfamiliar and scary for people who are maybe a bit hesitant about trying something new. Um, I would definitely have someone to give a friendly greeting. Just encourage members of the group maybe to look out for someone who's new to say hello. Because it can, I have been to a few activities where it can feel a little bit like there's an established clique, which is not great. So I think you really need to build being welcoming and making people feel valued into your activities. Um, One thing that works well for a lot of projects is a buddy system. So people who have been doing the activity for a while can offer to buddy up with people who are new. That obviously depends on the capacity that you have, but that's something that can really encourage more people to attend. And the nice thing about that is as people become more experienced, they then offer to become buddies themselves. So it's kind of a self-perpetuating system. Um, any project that's being run for health and well-being. So anything that's going to advertise itself as green and blue social prescribing, you have to put people first. So if it's if what's most important to you, if you're making, I don't know, if you're dead hedging or something, and the most important thing to you is having a perfect dead hedge, that's probably not a great activity for social prescribing. Maybe people who came into nature through social prescribing might want to do that as a follow-on activity. But with social prescribing, if it shouldn't really matter if people get things wrong, because it should be as much about their ability to connect with nature as about the results. Um, and I strongly recommend, if possible, making some social time, building that into your sessions. So if you can offer refreshments, that's always a bonus, even if just a cup of tea and just some time to chat. So those are the things that I've observed making other projects successful. Another crucial consideration is diversity and inclusion. London is an incredibly diverse city. Unfortunately, many friends groups are not. Um, if you were to come to me asking for support with developing a green or blue social prescribing offer, um, but the membership of your group doesn't reflect the diversity of your area, and you're also not actively doing something to address this, it's unlikely that I would be able to offer that much support. Um, Green and blue social prescribing are an excellent way to address health inequalities. This has been demonstrated, but the problem is that currently nature is still seen very much as a white middle class pursuit in this country, and not everyone feels at home in nature. So we need to be doing everything we can to address that. So what I would say is have a look at the current membership of your group, the current participation in your activities. If that doesn't reflect the diversity of your area, then you really need to sit down and have a think about how to address that before you start thinking about green and blue social prescribing. Um, and I do find that if I run a survey and if I ask organizations if they're inclusive or if they appeal to a diverse audience, Virtually all of them will say yes, but when I ask for details on how they're doing that, quite often the response will sometimes be, quite often the response will be, well, everyone's welcome to take part in our activities. And I should certainly hope that everyone is welcome, because you're probably breaking the law if they're not, but that's really not enough to ensure that you have diverse participation. So what I would recommend, if your group currently doesn't reflect the diversity of your area, is to reach out to organizations in your area that do work with some of those sort of minoritized groups, so ethnic minorities, religious minorities, LGBTQ community, whoever might be in your area. I mean, and you can simply just go to Google, just type in, Black organization and the name of your borough, and just find, community organizations that you could make contact with. And it's a matter of really just having conversations with them, seeing what they would like in terms of outdoor activities. And, it often will, for at least for white middle class people like me, it will often involve confronting some uncomfortable truths, but it is really worth it to ensure that your organizations include everyone. Okay, so I want to talk a little bit about what Natural England specifically can offer. So we have a range of activities and sort of institutions that we've set up under the banner of Happier Outdoors. So we have got a Happier Outdoors website, and I can just pop the link in the chat for you to have a look. But one of the first things that we did under the Happier Outdoors banner was the Happier Outdoors Festival 2024. So that was a festival held all over London. It was a very decentralized festival. 70 different organizations took part. And we had activities over a 10-day period in every borough of London, although not the city, unfortunately, but there was like a sort of home-based activity that people could do even in the city. And they were free activities, again, intended to connect people with nature, to introduce them to some of the green and blue spaces around them, and to really get them to think about the benefits of nature for health and well-being. So there were quite a few friends groups that took part in the 2024 festival, and you can see some of the quotes that we've had from them, that it was a great way of engaging with new people. So that's something that if you are looking to attract more people through green and blue social prescribing, I would definitely recommend that you take part in the next festival. And bringing publicity to friends groups as well was a big bonus. So we have got a full report there. I believe these slides will be circulated afterwards, so you can access these links. So there's a full report on the festival. It's over 200 pages that you can read, kind of every aspect of that. We also have the Happier Outdoors Network, and this is a network for organizations or, for independent workers across London who do have an interest in that intersection between health and nature, and especially in green and blue social prescribing. So we have now, I think, about 150 members. And we've been doing quite a lot with the membership. Currently, we're in the middle of a series of appreciative inquiry sessions, which are looking at the assets in each community, in each of the 5 NHS regions of London, kind of what people would like to see, what their vision is of how green and blue social prescribing can be, and how we can get there. So we've already had the Northwest and North Central appreciative inquiry sessions. These are some of the bits of flip chart paper we came up with from the Northwest session, where people were brainstorming their ideas. So they've got their what's working well, if anything were possible, and what can we do. The Northwest London one was quite interesting. The attendees came up with the idea of putting out a booklet to encourage people to spend time in their local park or green space to improve their health, and also letting them know of some of the activities that are available, some of the organizations that work there. So we are working on that project. It will be on quite a small scale. At the moment, I think it'll be about a dozen parks in Northwest London, parks or nature reserves. Once we have the full list of those, then we will put out an appeal for anyone working in those areas to have their information included in the booklet. So do watch out for that, because I'll pass that on to Laura to put in her newsletter. But anyone attending the meeting is very welcome to sign up to the network. We've got a little sign up link there, or if you follow the link that I put in the chat, there's something on the front page just saying click here to join. Yes, and so I talked about the 2024 Happy Outdoors Festival. We're doing it again in 2025. It's happening from 7th to 16th April. Like I said, you'd be very welcome to list any activities that you're running. Our requirements for activities are just that they're free, they are inclusive, so you're not excluding anyone from taking part. We have certain other things like you can't be doing, I don't know, Reiki in the park or claiming to heal people of their diseases and so forth. But last year we didn't have any problem with people trying to list events like that. So there's a full list of kind of terms and conditions. There are other things, you have to make sure you have, if you're taking people's personal information, you have to have data protection policy, you have to have appropriate health and safety in place and so forth. But the vast majority of activities run by Parks Friends groups would fit very well into the festival. It doesn't have to be something you're putting on, especially for the festival. It can be a regular activity that you do that you just want to add to our calendar, kind of to highlight it during that period. But if you, so there is a address there, which I think goes to the space for event hosts. But if you were to join the network using the link on the previous slide, then you would automatically get information about taking part in the festival. And that is it. So thank you very much for listening, and I'm happy to take any questions.
Yeah, so if you have any questions, you either put your hand up or maybe pop something in the chat. I thought the tips on how to welcome people and being really explicit and having consistency were really great. And also just to say as well, because Laura talked a lot about inclusion and making sure that our groups are really inclusive. And I think that it's something that we collectively all could definitely be doing better. But I think also there are many groups that are doing really interesting things and have had success in this area. So one of the things that the LFGN is trying to do is convene a working group on inclusion where we can do things like share best practice and share things that have worked really well so that other groups can learn from these experiences. So if you're interested in that, you've all got my email address. Please definitely do get in touch. It looks like Joy has a question. I think you're on mute, Joy.
Sorry. Can you hear me?
Yes, go ahead.
Oh, hello. Yeah, I'm the chair of a park in Kenton, which is on the borders of Brent and Harrow. It's a beautiful park, 30 acres. We have a river that runs through the middle of it. We have no shelter and we have no toilets. I have spoken to Brent Health Matters, which is an organisation obviously promoting health, and saying, how can we help people if we don't have these facilities? And I have got a council who is totally negative about toilets. If you mention the word toilets, they go. Now, in my opinion, this is totally backward thinking, but it's much more than that. I appreciate and accept that there is a lot of great work going on. Brent is a massive borough. I mean, I think 330,000 people. We have a really poor rate as far as diabetes is concerned. We've got one of the highest rates of diabetes in the country. And most people know that exercise, even just walking, is really good for people with diabetes. But 20% of this country is disabled. And 5% of this country have urine problems and toilet problems that we actually know about. I suspect it's a lot more because a lot of people don't want to talk about it. If we have a council which has the attitude of a dinosaur, that we can't provide. We used to have 2 toilet blocks in our park and they took them both away. And I, as a chair of the park, cannot feel that I could offer anybody anything. We also have a hospice that backs onto the park. And we work very closely with them. They told us they would love for patients to come out of the hospice and be able to come into the park. But obviously we would need facilities. And I don't know if we're alone in what we're experiencing, but I deliberately made time to come here this morning because I never know how these things are supposed to work because they don't seem to have a joined up approach. We tick all your boxes. We are more than multicultural. We have a multicultural committee. We don't have any problems with that at all. Local schools have children from 30 different countries. So we are just a mixed bunch, and everybody knows that that is one of the beautiful things about Brent. However, how can we get resistant, reluctant councils to get over this hurdle? Because if we don't, we can't offer anything. You know, I feel embarrassed, even people want to come and volunteer in our park, and I had to say, well, we've got no toilets, and we've got no shelter. So if the heavens suddenly open, everyone has told us that they want, you know, they want these facilities. And I've been told basically that I've got to get on with it. Well, I'm sorry. Number one, being chair of a park is a very busy pastime. And secondly, I don't have those skills, let alone raising the £500,000 to actually put this in.
Okay.
So I'm hoping that Natural England will hear what I'm saying and maybe go back to the government and say, you know, because if we could get a grant to do some of this work and then we could welcome people in, I'd love it. We get a yoga group working in our park in the summer. Automatically they just come in. It's great to see it. There's so many things that a park can offer. You know, we've got a garden, a beautiful garden that someone's created. They could work in there. We'd want to put raised beds in for disabled people. We know the benefit. Everyone who comes in the park goes away happy.
Yeah.
You know, isn't it worth the investment?
Yes. So thank you very much for that feedback. Is that Woodcock Park that you're speaking about, by the way? Okay. Yes. So I just want to address, first of all, the issue of government funding. I have very limited funding available to me. This year I have £10,000, which has to be used for all of the work that I'm undertaking. Obviously is not going to build that many toilet blocks. I would say relying on government funding is probably not going to be a winning strategy here, particularly funding for capital projects. Yeah, I just don't see much of that being available, certainly not through any pathway that I would have access to. However, there is funding available from other sources. Now, can I ask, when you say the council aren't being cooperative, is it purely because they don't want to pay for it, or what's the situation?
The Parks Department is completely cash strapped. They can't pay for anything other than basic maintenance. Their budget's been stripped bare. There is something called the Brent Environmental Network, which does other things, but they're not particularly in the parks. They're doing other initiatives. But, you know, I wasn't expecting you to say that the government's going to cough up £500,000 to put toilets, but I'm trying to get it over that the approach needs to be different. It needs to be joined up thinking. We have these wonderful ideas all the time.
So, sorry, can I just ask, did you have a question, or was it just wanting to make that point?
Well, I think I wanted to make that point because, you know, as I said, I'm thrilled that all the successful schemes are going ahead. To not be able to come to offer a cup of tea in our park, and we're on the Capitol Ring, and we had some poor soul who'd walked miles, and he said, as he got to the point, when have you got a cafe here? And I said, I'm sorry, no. And I just thought, well, hold on a minute here. This is the point I'm trying to make. You know, I would like to see, my vision is for parks to have well-being hubs where you are promoting the fact that you are, I mean, there's a woman who's written a book about the effect of green space on the immune system. I'm not just talking about oxygen here, I'm talking about right across the board. It releases chemicals. It is a very healthy space to be. But, you know, if you've got young children or you are disabled or just need the loo and you haven't got that, it will put people off. They won't be comfortable. And then we're missing a big cohort of the population who actually, especially if you're isolated and alone, there's nothing nicer. I cannot go to my park without saying hello to people. It's a very social space and we want them to feel
I
safe.
think we might. Sorry, Joy. It's an incredibly important issue, and I think a lot of people in the parks community can relate to the argument for toilets. But I'm also aware that we have a few other questions, so I want to make sure we can get to other people as well. Laura, did you want to say?
Yeah, so I was going to say, yes, this was my reason for mentioning toilets and, making a particular point of that on my slide, that, I'm very aware of how important this is. So a couple of things that I would say. First of all, if you do join the London Happier Outdoors Network, we have got a dedicated funding section on our website where I put all of the funding opportunities that I become aware of. And so there is funding sometimes for built projects. There are various, I think B&Q have a fund where they'll fund the construction of, I'm a little surprised the toilet block would be £500,000, but so probably not that much, but there are funding opportunities that friends groups can go for if they have been told that it's on them to raise funds for toilets. I would also say that if you are making the case, to your local authority or to anyone else about the need for toilets, we would be very happy to provide a statement just in support of that. Possibly not kind of a personalized statement for your particular project, but just saying that we are aware of the importance of toilet facilities and other facilities in encouraging participation.
Thank you.
Joy, I'm happy to, I'm sorry I cut you off earlier. I'm happy to exchange some emails as well. Also, just to add to Laura, I've heard that some councils have like mobile toilet units. So if obviously probably couldn't have that for every single event you did, but maybe, it would be something that you could offer a few times a year if you were able to liaise with your council in that way. Right, I think so. I think Des was next, and then we had some questions in the chat that I will move on to after Des. Des, would you like to go ahead?
Good morning. Can everyone hear me okay?
Yes. I can hear you.
Yes. I feel so sorry for the lady previously, but one thing you should think about is commercial and businesses, big businesses in the area. Go to them and maybe have a chat with them. They might be able to support you in getting something done. Anyhow, moving on, I missed the first 15 minutes of your excellent presentation, by the way. It was great. Really enjoyed it. You said green and blue prescribing. I just want to make sure that I've got it in my head what that means, the blue and the green.
Sure. So green and blue social prescribing is a way of saying encouraging people to spend time in and connect with nature to improve their health and well-being. So green is for land and blue is for water. I think blue is the one that tends to trip people up.
Yeah. Sorry.
Great. Do you have any other questions, Des? Oh, I think he's muted, so I think he must be okay. Just saw some so Pippa asks how to make it clear to park users and people self-referring that some activities are more suitable than others for social prescribing. Is there clear wording or a logo you can recommend to signpost the ones that are and the ones that are not?
So I think whether something is suitable is going to depend partly on the individual, but I don't know if that person wanted to give any examples of activities they would consider unsuitable. Sorry. What I would say is, if there is something that you feel would make an activity unsuitable for certain people, like maybe it involves a certain amount of physical strength or, anything of that nature, I would maybe just make that just simply say that. I think that's always the best way to make clear whether an activity is accessible, is to simply say what you have and what you don't have.
Mm. I think also using the example you gave during your presentation, if you wanted the perfect deadhead, for example,
Yeah.
then I guess it would be a case of maybe describing skills or experience that you would be looking for, perhaps.
Yeah, I think saying, this is best suited for experienced gardeners.
Mhm.
Maybe, if you do have some target, like say the council have asked you to do a certain task in an area, just make clear we are doing this to a target from such and such council. And that will just kind of get across that it is more of a sort of focused activity, and that with perhaps less room for sort of flexibility.
Mm. I think, Des, you've got your hand up again.
Yes, I don't want to hold the
Oh, no, you're fine.
Q&A. What it is you mentioned earlier about underrepresentation of Black and ethnic minorities or
Mm-hmm.
minorities in general. Why do you think that is?
So, obviously, I will mainly go off the feedback that I've been given from people of color and other, members of minoritized groups. One thing I'm told is that I think Black Londoners in particular, when they go into green spaces, they will sometimes be treated as if they're up to no good. And I heard this from, it was quite an exclusive sort of garden in London. Well, viewed as quite exclusive. They're trying to now become more inclusive of the community. But I was actually told by a staff member there that since they had made that effort to become more inclusive, they'd have kind of some of the more regular members of the, visitors to the garden who would be kind of older, quite wealthy, white people would come to the staff and say, oh, there's someone over there in the gardens. I think they're up to no good. And then, of course, it turns out that it's a Black person. And yeah, I think there's a lot of that kind of attitude around. There's an attitude as well of maybe rural spaces being less safe, less tolerant. And although we don't really have rural spaces in London, I think, a big park can kind of remind people of that. I know, especially with like the LGBTQ community, a lot of folks have moved from rural areas to urban areas in order to feel more accepted. So there can be kind of a feeling that they've been forced out of nature, that they don't belong there. Which of course isn't true. Nature is for everybody. Um, I think there can be issues as well. I've had the feedback with, for example, Muslim women's groups. They need to have a place to work where, men passing by aren't going to be able to kind of stare at them. And again, with those groups, toilets and hand washing facilities again were really important. So yeah, I obviously can't speak for all minoritized groups. I'm not really in a position to experience that myself, but those are some of the reasons that I've been given. Oh, and another one I would say is just that, the nature conservation sector does tend to be overwhelmingly white and middle class, and that can be quite a self-perpetuating phenomenon.
Okay, thank you. Oh,
Thank
by
you,
the way,
Tess.
can I just say, because I know I'm not on screen, I'm a Black and ethnic minority person, just in case
That's
anyone
fine.
was wondering why I brought it up.
Yeah,
But
I hope nothing I said sounded too crazy there.
no, it didn't. No, I hear that all the time.
Mm.
Our organisation, we're in a very diverse area in Newham, East London, one of the most diverse places in the UK, I think I heard. Um, and you can't drag people in, screaming and shouting. Yeah, they've got to want to come in. So as you
Right.
said before, all the things that you suggested is that sometimes we need to think about these things.
Hmm.
Okay.
Definitely.
Okay. And yeah, thank you very much. And once again, thanks. Great presentation.
Oh, well, thank you. I really appreciate you listening.
Thanks, Des. Does anyone else have any other questions for Laura? I think we've gone through the ones in the chat. Oh, someone's just joining the webinar. Any other questions? Oh, any advice for friends groups who currently only have activities every few months? For example, litter picks, bulb planting. Can this still offer social prescribing opportunities? Just before Laura answers, I was thinking when you were talking, Laura, during the presentation that like bulb planting is such a great social prescribing activity because it doesn't require um, it doesn't require previous knowledge or experience. Really easy to teach someone how to do, and it's quite a social thing as well, I think. But anyway, go ahead, Laura.
Yeah, so if it really is every few months, I think that's probably not something you would want to promote to like link workers because that's most people are going to need something more regular than that. But it can be kind of promoted as maybe a taster session. You know, if you just have posters up, if you could give posters to the local GP surgeries, have them display those, and it could just kind of be framed as come and discover your local park, see what it has to offer. Um, and yeah, if the friends group has anything else, like if members of the friends group have anything else going on, it could also be kind of an introduction to the friends group as well.
Yeah, that's a good point. Yeah. Any other questions for Laura? I don't think we've got anything else in the chat, so last chance. Okay.
Oh, someone
Oh,
has actually put their hand up
Yeah.
physically.
Me.
oh, I'm
Jean.
sorry.
Me. Sorry.
All right, go ahead,
Yeah.
please.
Yes. I wanted to agree with Des that I have thoroughly enjoyed the presentation today. So
Thank
I'd like
you.
to say thank you. Thank you.
Oh, well, thank you very much. That's very kind.
Oh, thank you. We've got someone from Downham Family Medical Practice, which would be great to get your perspective. Do you want to go ahead, please? Vebavi? Hello? If you're, I think you might be still on mute if you're trying to, let me see if I can unmute you. Oh, no, you are unmuted. Did you have a
Yeah,
question?
can you hear
Oh,
me?
go ahead.
Can
Yes,
hear you?
there we go.
Yeah, okay, yeah. Thanks, Laura, for the presentation. It was amazing.
Oh, thank you.
And yeah, so I'm working as a social prescriber only with Seven Fields PCN, and it's the first time I'm getting any sorts of presentation for green social prescribing. Is there anything that, as a social prescriber, I can start like picking small steps and anything that I can easily achieve as a social prescriber to start with my local parks? I'm also involved with one of the park locally, so I can have some activities. Is there anything that like very easily can be targeted?
Um, so I would definitely have a look in those parks to see if there are any posters or anything advertising activities. And I think Laura as well would be a good person to tell you if there are friends groups for those specific parks, because I think reaching out to them, you may very well get a positive response. And I would say maybe ask if they can arrange perhaps just a tour of the park, maybe for you or a few clients, and yeah, maybe just see how things develop from there.
Okay, yeah, sounds good.
Okay.
Yeah,
Yeah,
we're just
thank
thank
you.
you
Thank
for
you.
saying that, Laura. We have we're in touch with around 600 friends groups in London, so chances are we may be in touch with a group that's quite near to you. So yeah, please do get in touch. That was a great question. Thank you. Also, just to highlight in the chat, Jeff from Wandsworth has said that he's worked with Thrive, a horticultural therapy group, and they do they're active in Battersea Park and have done Happier Outdoors. So yeah, that sounds like a really interesting one to check out. And also, Sue says that there's good support from the council in Lewisham. So that's really good to hear as well.
Yeah.
I'm just gonna see if anyone's waving their hands. I don't see any other hands up. Does anyone else have any last questions? So yeah, I will share Laura's slides with the sign up list, and I'll also circulate a link to the presentation. It won't be today, but hopefully by the end of the week. So yeah, if there are no other questions, I just want to say really big thanks to Laura. This was really fantastic. I've definitely got some really good tips for my own friends group, and yeah, I really hope that you've all benefited from it. I'm sure you have, and yeah, it was really great. So thank you so much, Laura.
Oh, thank you for having me.
Great. Just one last note from Alana. She says in Lewisham, Sydenham Garden is doing great work in social prescribing. So yeah, it's really great to have these contacts, and hopefully we can all inspire each other and share tips. So perhaps I'll include something in that in the next newsletter, so that we can all help each other out on that. But yeah, I will sign off now. And yeah, just thank you very much, Laura. That was really great. Thanks for your time. And
Thanks,
thank you everyone for
everyone.
joining.
Have a
Thank
good
you.
week. Bye-bye. Bye.
Thank you. Bye.